There's many reasons for the modern widespread deficiency of vitamin K2. Our aversion to eating offal, animals raised eating anything other than grass, factory farms, high antibiotic use in animal feeds and in humans, animals fed GMO, corn and soy, soil depletion, glyphosate, processed foods and dysfunction of the gut. If you're taking a statin or a blood thinner, you should know that these drugs create a deficiency in vitamin K2. Our elderly ancestors ate more of this nutrient as they aged. Vitamin K2 is important for calcium homeostasis, so if you have osteoporosis, cardiovascular disease or coronary disease, kidney disorder, diabetes or cancer, it may be due to a deficiency of this nutrient. Tooth decay is another sign of a vitamin K2 deficiency. Children brought up on diets lacking in K2, starting in the womb, tend to have narrower faces and crowded and crooked teeth. Cheese contains vitamin K2 in the form of MK4, as well as longer chain MKs. Cheese is made by adding different bacterial cultures to milk, each one producing a different effect. Typically, the MKs found in cheese, from the greatest amounts to the lowest amounts, are MK9, MK4, MK8, MK10, and MK7. A study testing 84 different foods found that the most contained small amounts of vitamin K2. Rarely longer chains exist. It's mostly the MK4. In offal, small and moderate amounts of MK6 to MK10 have been detected. Fish typically have small amounts of vitamin K2 as MK4. Vitamin K is a crucial nutrient for calcium metabolism and bone health, blood clotting, heart health, and more. K2 is the form present in animals and fermented foods. As a supplement, vitamin K2 can help with osteoporosis, heart disease, inflammation, and more. Vitamin K2 is also known as menaquinone. It's involved in blood clotting, bone health, and the regulation of some cellular functions in the human body. Vitamin K2 is also important for the regulation of cell growth and maintenance of the arterial wall. There's two main types of vitamin K2, the MK4 and the MK7. Vitamin K2 in the form of MK7 has a much longer half-life than the synthetic K1. This means that it stays in your body for longer. Vitamin K1 comes from plant sources, while animal foods and some fermented products contain K2. Humans can partly convert the K1 to K2 to produce the K2 with the help of probiotics. It can promote strong bones and teeth, improve cognitive performance, decrease inflammation and help some autoimmune conditions. It can reduce the risk of heart disease and improve circulation. Vitamin K is a cofactor for Y-glutamyl carboxylase. This enables the carboxylation of glutamic acid to Y-carboxyglutamic acid. This reaction makes it possible for proteins to bind calcium, which in turn is important in blood clotting or coagulation. Calcium binding is also an integral part of bone health and strength. Vitamin K2 helps to transport electrons in the mitochondria, similar to ubiquinone or CoQ10, and this helps to boost mitochondrial function and to create energy. However, in mice liver cells, it wasn't able to replace all the functions of CoQ10. In a fly model of Parkinson's disease, the K2 was able to help by improving the mitochondria. Vitamin K2 with an electron has an antioxidant property, and this can prevent glutathione depletion and neuronal death in cultured neurons. Check out my videos on mitochondrial boosters, Parkinson's disease, glutathione and antioxidants for more information about these. Vitamin K2 is the principal form of vitamin K that the brain uses. Vitamin K2 as MK4 was found to represent greater than 98% of the total vitamin K in the brain, irrespective of age. Studies have found that patients with early stage Alzheimer's disease consume less vitamin K than did cognitively intact control subjects. Vitamin K's effects are hypothesized as a result of sphingolipid metabolism. Vitamin K2 as MK4 positively correlates with sulfatides and sphingomyelin, two brain protective components. Check out my video on Alzheimer's for more information on treating this condition naturally. Vitamin K2 can help with hemorrhagic disease in newborns, hypoprothrombonemia or impaired blood clotting, vitamin K dependent clotting factor deficiency, and warfarin and other anticoagulant toxicity. In order for the bones to take in calcium, they need osteocalcin to bind to the calcium. This is released by bone cells or osteoblasts. Osteocalcin needs vitamin K2 to become fully activated and to bind to the calcium. Vitamin K2 maintains and it improves bone mineral density. In studies of postmenopausal women, higher levels of vitamin K2 help to prevent bone fractures and to improve bone strength. Vitamin K2 deficiency can lead to arterial defects and osteoporosis as calcium gets deposited in the blood vessels instead of the bones. Low levels of vitamin K2 were linked to increased inflammation, fractures, and bone pain. According to a review of 8 smaller Japanese clinical trials, vitamin K2 supplementation increases bone mineral density and it lowers the incidence of fractures in postmenopausal women and in osteoporosis. A much larger trial of over 4,000 older Japanese women found only minor benefits from vitamin K2 supplementation. It reduced the risk of spine fracture only in women with advanced osteoporosis. A recent update warned about low-quality trials in older reviews with positive results and suggested further investigation. Another limitation is that all studies were done on Japanese women. Vitamin K is an essential nutrient for bone strength. Vitamin K2 supplementation may help with osteoporosis in postmenopausal women, but the effects may be mild. Check out my video on osteoporosis for more natural treatment methods. There's an association between a higher intake of vitamin K2 and lower risk of heart disease. For every 10 micrograms of vitamin K2 consumed per day, the incidence of heart disease was reduced by 9% in a comprehensive trial on over 16,000 women. Vitamin K2 prevents calcium from being deposited in the arteries and causing atherosclerosis, which is a major risk factor for heart disease. In a study of 4,800 participants, people with the highest intake of vitamin K2 were 52% less likely to develop calcification of the arteries. They had a 57% lower chance of dying from heart disease over a 7 to 10 year period. According to a review of 27 clinical trials and over 12,000 participants, vitamin K2 supplementation significantly improves the calcification of blood vessels, but it doesn't improve their stiffness. Additionally, some studies used vitamin K1. The optimal intake of vitamin K2 may help to prevent heart disease. High vitamin K levels were associated with lower inflammation rates and C-reactive protein values in a study on over 1,300 participants. A study of 380 women had similar results but failed to confirm the benefits of supplementation. In 158 women with rheumatoid arthritis, a daily dose of 45 mg of vitamin K2 reduced inflammation and disease activity. Vitamin K2 administration had beneficial effects in an animal model of multiple sclerosis. More research is needed to evaluate the beneficial effects of K2 supplementation on inflammatory and autoimmune conditions. Higher vitamin K2 but not K1 intake was linked to a 63% lower rate of advanced prostate cancer in a trial on 268 patients. An increase in dietary intake of vitamin K, both K1 and K2, was associated with 2 times lower cancer mortality in over 7,000 study participants. According to a review of 6 clinical trials and 930 patients, vitamin K2 supplementation may improve overall survival and reduce the recurrence of liver cancer after surgery. However, the beneficial effects were seen only after 2 to 3 years of follow-up. Larger, well-designed trials would be needed to investigate the potential anti-cancer effects of the vitamin K, dietary intake and the supplementation. An increase in dietary intake of vitamin K was associated with a reduced risk of dying from all causes in the Mediterranean population. Vitamin K2 supplementation for 4 weeks increased insulin sensitivity in 33 healthy young men. Some hypothesize that vitamin K can help with varicose veins. However, the study that most people are citing doesn't say that the vitamin K helps. The study says there's an increase in MGP, or matrix GLA protein, in varicose veins as a result of calcification in the blood vessels, and it's thought that this contributes to the varicose veins. On the other hand, MGP is a strong inhibitor of vascular calcification when it's carboxylated. Vitamin K2, but not K1, is needed to carboxylate the MGP, which helps to avoid the calcification in the arteries. All forms of vitamin K supplements significantly reduce the effectiveness of warfarin and other blood-thinning medication, leading to potentially fatal complications. Patients on blood thinners should monitor their vitamin K dietary intake carefully. Population-based studies have linked a high dietary intake of preformed vitamin A or retinol to a greater risk of osteoporosis and hip fracture. This is because vitamin A competes with vitamin K2 and vitamin D3, both of which are important for bone health. Broad-spectrum antibiotics can contribute to a vitamin K2 deficiency as a result of killing the bacteria that produce the K2. If you're taking a bile acid sequestrant, such as cholestyramine, this will also increase your need for vitamin K2, since K2 is absorbed in the bile. Other patients who are at risk of a deficiency include liver disease patients, patients with inflammatory bowel disease or cystic fibrosis, and babies who are exclusively breastfed. Vitamin K2 is generally higher in the fat of animals, especially those who are grass-fed. K1 is found in plants. Dietary intake of vitamin K2 accounts for up to 25% of the total vitamin K intake. Humans can partly convert vitamin K1 to vitamin K2 in the body, but the conversion process is inefficient. Vitamin K2 is also produced by gut bacteria in the large intestine. Specifically, lactic acid bacteria produce the K2 in the form of MK4. Vitamin K2 is found in fermented foods, liver and organ meats, and dairy products from grass-fed animals like cheese, curd, yogurt, and milk. For more information about vitamins, herbs, supplements, or health conditions, check out my website.